Hello, Dr. Keith Smith, Surgery Center of Oklahoma, with you once again. Let's make believe today that we are a big hospital administrator. A surgery center or a physician-owned hospital has decided to build a competing facility down the street. You're the hospital administrator. What do? Well, I'll tell you historically what they've done. One of the first things they did is they were instrumental in getting states to implement certificate of need laws so that any physician or physician group that wanted to build a surgery center or a hospital had to go before a panel of very concerned citizens, almost all of which were parties to or part of one of the big hospital systems. As you can imagine, they were not typically open to a competitor opening up down the street. These certificate of need laws are present in many states and to this day continue to represent one of the major obstacles for new competitors to enter the marketplace. And that, of course, is one of the reasons healthcare is so expensive in this country, is that there is a lack of competition, and it seems to be thwarted at every turn by these big hospital administrators. The second thing you might do is lobby your congressman in Washington and say, well, if they're successful in building this facility, let's discourage payment to them. So the government, Medicare and Medicaid, pays the big hospital systems much more than it does for the very same services provided by physician-owned facilities. Then you might go for the granddaddy of them all. You might actually look for the government to proscribe, to completely prohibit the building of physician-owned facilities. That actually is in the Unaffordable Care Act, a provision meant to garner the support of the American Hospital Association that prevents building physician-owned hospitals. Actually doesn't prevent building them, it just keeps them from accepting any money from the government, which for most hospitals is, and most physician groups, thinking about building a hospital is a very scary thing. It's very effective. One of the other things you might do is act locally and go to, I actually know of a case where this happened, where a hospital went to city council and they went to the zoning commission, and property that was properly zoned for a physician-owned hospital, it simply had its zoning changed in the middle of the night at a meeting no one attended, where basically the physician group had bought this property, they were ready to get started, and the zoning was changed on them, and the rug was pulled out from under their feet. So if you were a hospital administrator, that might be one of the strategies that you would employ to prevent any competitors from coming into the marketplace. Another thing you would do is talk to your insurance pals. You say, we got these guys going down the street, and it might work pretty well if they were just not ever allowed to get in your network. We don't care if they're any good or if their pricing is any good, but keeping them out of the insurance network will darn sure make sure the number of patients that can actually access the facility, if they're successful in overcoming all the other obstacles we have in mind, they'll see to it that they won't stay open for long, or that we can go in and buy them out very cheaply. Another thing you might do is work with accreditation agencies. Come up with rules that just make it almost impossibly expensive to operate. There are all manner of regulations and rules that govern how a medical business should conduct their operations, and even some health departments, state health departments, have gotten in on this action, where new rules and regulations are given out so that the facilities the smaller facilities can't possibly meet the expense or meet these and comply with these regulations. So if you're a hospital administrator, you might see to it that impossible obstacles were created for the smaller competitors by either your state health department or one of the accreditation agencies. The other thing you might do is limit how the profits from a physician-owned facility might be distributed. Pete Stark from California actually has created what are now referred to as the Star Clause. Because we can't let these physicians be self-dealing. We can't let a physician own a hospital But somehow we could let a hospital own physicians and not look at that very carefully and what self-dealing goes on there at their high prices. These are just some of the ideas that you might have if you were a hospital administrator to thwart your competitors and to make sure you didn't have to compete. You could charge people whatever you could get away with. The other thing you could do is compete. The other thing you could do is say, you know, our quality is great. We're going to make it better though. And our prices, we're going to be price competitive. We are going to show a value. We are going to embrace the discipline of the free market, the beneficiary of which we know primarily are the patients. But that is not how it works in the United States, is it? Thank you for watching. We'll see you next time.